Hi, my name is Kelsey Reardon. I'm a pediatric nurse practitioner. I work in both the inpatient and outpatient settings for a children's hospital located in Minneapolis, Minnesota, United States. Today I will be presenting on hypnosis and the role of co-therapy in integrative pediatric pain management. Pediatric pain is a common symptom in both the inpatient and outpatient populations. Our children's hospital serves primarily medically and psychosocially complex pediatric patients. The presence of an integrated health and well-being program offering comprehensive assessment and multimodal treatment options has allowed for individualized and innovative therapeutic plans to address pain and the anxiety which often accompanies it. Both safe and effective, the addition of non-opioid, non-pharmacologic interventions are often requested by both patients and families. Hypnosis, with its evidence base as an accessible and easily taught mind-body therapy, is an excellent foundation from which to add other modalities. We report during this presentation 3 clinical case studies in which combination of these integrated modalities led to successful outcomes in managing pain. Hypnosis is a very interesting and unique integrative modality. It engages regions of the brain associated with attention, executive control, and cognitive monitoring. The focused state of attention that patients can achieve during clinical self-hypnosis allows for reduction in pain. It corresponds to deactivation in the anterior part of the default network, which this is often associated with social cognition, internal attention, and self-related thought. There's an anticipatory process to the affective dimension of pain. Pain is a multidimensional experience. Patients can experience it in a variety of ways, which means it is important to listen to the patient and determine a plan which can help reduce the pain using those specific integrated modalities. Changing the words that are used in hypnosis can often change the part of the brain that perceives pain, which allows us to successfully treat pain in pediatric patients. The autonomic nervous system is important to understand as you work with patients who have pain symptoms. The autonomic nervous system comprises both the parasympathetic nervous system, which is our rest and digest, and the sympathetic nervous system, which is the fight or flight. Using hypnosis, we can access the vagus nerve. Accessing the vagus nerve can affect various body organ systems, such as the heart, and by accessing the vagus nerve, we can help to decrease the heart rate. We can access the liver, which helps regulate insulin secretion, the gut, so we can promote gut motility and increase gut function, along with many other systems of the body. It's important to recognize this as many of our patients often present in the fight or flight state or primarily in the sympathetic nervous system, and we work hard to incorporate aspects of their treatment plan to help incorporate and emphasize the importance of the rest and digest state or the parasympathetic nervous system. Our objectives of these studies was to examine the purpose of combining integrative therapies in a patient and diagnosis-specific manner. We also want to explore the accessibility of this approach, which I will talk about in further detail later in this presentation. Patients often present, like I said, with varied pain presentations. It is important to give patients options to practice at home, as they often find it difficult to come for weekly appointments, and it is important to continue the practice at home, which allows for further development of decreased pain symptoms. Hypnosis is a state of aroused and attentive focal concentration with diminished peripheral awareness. That focused state of attention allows for the elements of absorption, dissociation, and suggestibility, which then allows us to give messages such as decreasing pain or discomfort and allowing the patient to possibly have other symptoms decreased, or improvement in sleep and anxiety. We had 3 cases in this study. The first patient was a 15-year-old male with primary Raynaud's syndrome and hyperhidrosis. We used biofeedback with palm temperature and heart rate variability using the InnerBalance app through the heart rate sensor attached to an iPad. It was combined with the skill of clinical self-hypnosis, which was taught to the patient. Patient number 2 was a 15-year-old female who presented with headache and severe neck muscle twitching. We used heart rate variability biofeedback and self-hypnosis with this patient. Patient 3 was a 19-year-old female with constipation type irritable bowel syndrome and localized pain. We use acupuncture and self-hypnosis with patient number 3. These are our integrative clinic rooms, which we are very proud of. Our integrative clinic rooms often make patients feel more comfortable and able to relax in the environment of a clinic setting. We have our poof chairs, which you will see in the first picture, which is a chair that most patients often love sitting in, and some have even asked if they can take home with them. We have the murals, which were painted by patients in both of our 2 rooms, and massage tables. The rooms themselves are less clinical and more focused on doing integrative modalities. This is the equipment that was used in these 3 cases. As you can see, this was what was used for the palm temperature in patient number 1. Patient number 2, and it was also used in patient number 1, this was the equipment used for the Inner Balance Heart Rate Variability app. This is a sensor along with 2 pictures of what we see using that app, Inner Balance. Here's a picture of acupuncture needles, which was used for patient number 3. We use these 3 different types of integrative modalities combined with hypnosis to be both patient-specific and diagnosis-specific. The results of the studies. The results were quite amazing. Patient number 1, after his 3rd session and continued improvement in symptoms, was able to practice at home independently and able to participate in his chosen sport. In addition, he agreed to see a therapist to discuss his anxiety and the increased pressures he was experiencing in high school. Patient number 2, she experienced significant improvement in both headache and neck twitching after 4 sessions and chose to discontinue her visits because of her such improvement. At her last session, we encouraged her to add magnesium to her daily regimen and to return if she needed a refresher or had any changes in her outcome. Patient number 3, she reported significant improvement after the 1st session and practice at home, as well as incremental improvement thereafter. She is currently continuing her home practice of self-hypnosis and self-massage and becoming more interested in changing her diet to add to her comfort. What we learned. We had many takeaways from these 3 cases. We learned that using more than one modality is important as it can broaden the toolbox for each patient. We also learned that some patients need 1 active and 1 passive skill, whereas others need 2 active skills. We learned that the patient always has control and learns new techniques on a continual basis. Since this initial abstract, we have also explored co-utilization of hypnosis with Reiki, aromatherapy, yoga, massage therapy, and frequency-specific microcurrent, with similar success in managing pediatric pain in our patient population. Combination co-treatment of hypnosis with acupuncture or biofeedback can be successful for the treatment of pediatric pain. All of the modalities used in these cases overlap with areas of pain reception and/or mediation. We had few adverse effects and expect that there would continue to be few adverse effects with subsequent studies. Hypnosis, with the characteristics of focused attention, imagination, and self-empowerment, is ideal to combine with other therapies to achieve pain relief in children and adolescents. Future direction. Since COVID-19, we have seen an increased need for virtual medical visits. With these visits, we have found challenges with hands-on teaching, but success with certain patients who can learn the skill of clinical self-hypnosis. We look forward to exploring ways of combining modalities applicable to virtual visits and assessing our future pain management patients in the pediatric population. Thank you for your time today. Please reach out if you have any questions.